Now we have Representative Danny Davis of Illinois. He's on the committee, Ways and Means Committee, ranking member of the Worker and Family Support Subcommittee on Ways and Means. So Danny Davis, really great to have you, sir. How are you?
I am wonderful.
Thank you so much, my friend. Thanks so much for joining us today.
Thank you.
I'm glad we were able to get you off the hill down here to the Great Willard Hotel where Ulysses Grant hung out. I was like looking at all the Ulysses Grant stuff. I enjoy that, this place. So thank you for coming. And we've been talking about every corner of the healthcare ecosystem in America. And you've been a leader on this. You've been working for years to kind of look at underserved communities, community health centers, which we talked about. We had a breakfast this morning where that was very much part of the discussion, as we're also thinking about what we call bold bets, innovation in this place, and making sure that those bold bets are felt by everyone and not just some. But would love to get your map of what you think our policy deficits are right now.
Well, let me just thank you so much. As a matter of fact, anytime you say health, I come running. I happen to believe that there's nothing in life except life itself more important than health. So being healthy, having a healthy environment, means that you're in a position to be the most productive citizen you can possibly be. And I think that's what really attracted me to health.
Well, tell us what we are not doing to achieve that vision of health that we should be doing.
Well, I come from a perspective of having grown up in rural America, went to a one-room school. My one teacher, Miss Beatty King, taught 8 grades plus the little primer and the big primer. My parents were sharecroppers. They grew corn, cotton, and all of those things. And so I've been around long enough to have seen lots of change. I'm 84 years old. Been blessed if we go to church. Fortunate if you do it some other way. But what we're not doing enough of is providing information to individual citizens, because after all the technology, after whatever it is that systems do, after whatever it is that physicians and nurses and PAs tell us, if we don't practice it ourselves, then we are neglecting the possibility of being healthy. And so the ultimate responsibility comes to the individual, I've worked in clinics. I've served on the boards of hospitals. I represent an area that we call a health mecca. There are 23 hospitals in my district. There are 12 federally qualified health centers, some of the best you would ever find. Great research institutes. And yet, in many instances, we have individuals with some of the most negative health indicators that you would find.
Right next to those 23 hospitals.
Right where these institutions exist and where they do what they do, but we have large numbers of individuals who are diabetic, large numbers of individuals who are obese, large numbers of individuals with amputations, large numbers of individuals who have behavioral health issues and problems that are not dealt with. So, notwithstanding the fact that we've made progress, we've made progress, we still have not become the healthy country that we have the potential of being. And so we got a lot of work to do in order to try and make that happen. And individuals must be at the base of that work as opposed to just being something to work on.
In your caucus and in Ways and Means, I don't know how to ask this other than, we're here today. We're spending a whole day doing this. We brought some incredible people from both sides of the aisle coming in. And the message that I'm hearing is very similar. So there's actually much more overlay of opinion from different corners on this. What I'm interested in is then what's the decibel level of concern among your colleagues in Congress in actually solving that gap, that absence of a bridge that you just described in even your own district?
Well, there are some things that we cannot escape from. Oftentimes, we will agree on issues, we agree on need, and we get down to the point of what we need to do, of what we need to have in order to correct whatever it is, trying to figure out how to pay for it. When I got involved in this business, I said, it's going to be great to be an elected official. At the end of the year, I will have been a member of something for 46 years. Local level, county level, national level, World Health Organization, all over the place. Figuring out how do you pay for what it is that you want. You must invest enough resources in order to make it happen. There's much that we don't know. How do we find out? We research it. We test it. And if we don't have the research apparatus, the research money, it's hard for me to figure an administration or government or anybody who say that they're going to improve something, and then you take away what you need in order to do it. Like you're going to improve health care, but you take away Medicaid money, or you take away research money. Well, how are you going to do it if you don't have the resources and you don't allocate the resources or make the decision that what you want it bad enough that you will figure out a way. You will make the sacrifice if that's what it takes in order to do it.
I was talking to some of our friends from Lilly this morning about some of the products they have out there that are very popular, but there's also, you talked about rural Illinois, rural districts and whatnot, is the accessibility, having that gap filled. I'm really interested in that bridge. I was just recently down in Texas. We did in Austin. We did a healthcare forum around mental health, brain health, and I met a Republican chair of the House Public Health Committees from Texarkana who was saying, look, all of our health facilities in rural area are contracting. We're having less and less out there, and we've got to fix it. So he'd be on the same page. But I'm just interested in whether you think there are opportunities in telehealth, or what dimension of this might you be able to bridge that gap?
I think the focus that we have seen on rural America is just great. Even though I live in an urban, big city environment, I support everything that we have attempted to do and attempt to do for rural America, because obviously I've had that experience as well. But there are many similarities to rural America and urban inner city America. And when we started talking, say, on Ways and Means about rural America and set up a task force, I said, let's make that task force rural America as well as urban inner city America, because many of the issues are essentially the same.
Do you think that, I don't know if you heard Callie Means talking about processed foods and their inclusion in school lunch programs, various food programs, U.S. government programs. Do you think we need to revisit that and somehow pump in healthier foods, non-processed foods into that system? Would that be wise?
No doubt about it. As a matter of fact, what you eat has a great deal to do with your health. And as a matter of fact, some mornings when I'm on my way to work and I got to stop and get gasoline, and I see children in the stores purchasing Hottie Hots and whatever it is that they're going to have for breakfast, I feel terrible for them in terms of saying, this is what they're having for breakfast. I mean, and I know that's what they're having because I'm there and I see them. So, yes, I think that food and nutrition are big factors and that we need to put more attention and give more attention to it. And we need to have the kind of advocacy that will cause decision makers to say, yeah, you're right.
Do you know, you were in Congress with Brad Wenstrup when he was a member.
I sure was.
So we had Brad here, and he's a doctor.
Dr.
And
Wenstrup.
he's now director of something called the Alliance for Excellence in Health, or Health Excellence. And he made a comment in here. He said, that very often doctors engage with their patients and they come up with a treatment course or a prescription course or something like that, but then it's not covered by insurance. And so he's kind of raising the spotlight, the decibel level on that. And I am interested in the social contract and the players around this issue on whether or not we need a bigger spotlight on the insurance parts of this, the people being covered and denied, how to get that, because you're just seeing it percolate in the media a lot more. And where is that for you, Danny, in terms of thinking about another element of this that needs to be addressed?
I think that is so important. The same as I think that people often don't know as much as they need to know and should know and ought to know, and would be helped if they knew how we pay for these things.
Right.
I'm saying it's one thing to say, I want so-and-so, or we ought to have whatever it is. But, I read a guy named Frederick Douglass, and he said that one thing he knew if he didn't know anything else, he knew that in this world of ours, you may not get everything that you pay for, but you will pay for everything that you get. And if you don't pay one way, you will pay another way. And so it's good to begin the conversation. But then if you say, I want everybody to have access to the highest quality health care that we will be willing to pay for them to have. I want to pay to train physicians so that we won't have a physician shortage. I want to pay to train nurses so that nurses can be there to give information and give themselves and their practice. But we got to figure out how to pay for it. We got to pay for it.
Yeah, well, I think we had Wayne Frederick here from Howard University. He's the president up there this morning talking about exactly that. We got to figure out how to get these people in, what the pipeline should be. Let me just ask you one last question. I'm personally interested because you come from a community where this set. During COVID, we kept hearing about the lack of trust, particularly from certain, Black communities in the healthcare system. And I hear about it a lot. There's no trust. People don't see themselves in the system. We see the life expectancy differences based on what zip code you're in, the social determinants, which I know this has been a big issue for you working on. And I know there's no silver bullet solution to solve it all, but gosh, is there anything that can be done that's transformational on that front so that at least the trust problem is not remedied, but moved back. I don't want to be naive, but it comes up every time we do this. And I'm just interested in how do we make that conversation go away?
We're making progress in that. I wear a Tuskegee jacket. Tuskegee Airmen gave me one.
Yeah.
So we're aware of the impact of atrocities that have existed. But we have to go beyond that. That was yesterday. I've been engaged in many research projects with institutions, with physician associations and all. And so, yeah, it's not easy. It's not easy to convince, but if we start early enough, and if we start early enough with children, especially children, then we help move us beyond what happened at Tuskegee or what happened in Mississippi or what happened in Arkansas. America has so much potential, but we can't live in the past. We learn from the past, and it projects and tells us what we need to do for the future. So I'm optimistic, even as difficult as sometimes it seems. That's why I keep doing it.
Well, I'm going to have you back. You're going to have to come back next year when we do the next year iteration of this. I'm going to say health again, health policy, and we'll hopefully have you down here again.
I'll be 85 then, and I'll be glad to come back.
Representative Danny Davis, thank you so much. Thank you, sir. Here.
Thank you.
Great. Thank you, my friend. Thank you very, very much. Thank you.